Good morning and welcome. I'm Anthony Johansson. I'm a geriatrician in Cardiff. I'm an ortho-geriatrician in Cardiff, so I pick up the pieces of our failure to prevent fragility fracture on a daily basis. And I also lead the National Hip Fracture Database, so the national audit of hip and other femoral fractures that documents the extent of that as a public health catastrophe for our population. Inder Singh is a consultant geriatrician here in Gwent. He's pioneered all sorts of services, and we could go through his CV at length, but we're going to cut to the exciting part of the day. He's been the national clinical lead, our national clinical lead. He's chair of the Falls and Fragility Fracture Programme Board within Welsh Government, and he's responsible for all of us being here today and most of the progress that we're going to hear about and we're going to make following on from today.
So good morning, and everyone, thank you for coming today and to the second national conference. We had first conference in October 2022, and we have doubled the number of turnout today, so well done team. To begin this morning session, I'll invite our first keynote speaker to the stage, our Cabinet Secretary for Health and Social Care for Wales, Eluned Morgan. Welcome.
Bore da I chi gyd a diolch I chi gyd am ddod i'r cyfarfod yma heddiw. Dwi'n gwybod tro diwetha nes I ddod yma llawer ohonoch chi a ni wedi bod yn trafod pwysigrwydd iechyd esgyn a sut allan ni weithio gyda'n gilydd I wella gwasanaethau I bobl sy'n cwmpo ac yn torri esgyn a gewn ni ati unwaith eto heddiw. Thank you so much for inviting me again. I'm really pleased to be here again as a member of the new cabinet. The NHS, of course, never stands still. It constantly evolves as new treatments and new services come online and as we seek to provide more care closer to people's homes. But unfortunately, there are some things which remain the same. People are still experiencing falls and breaking their bones despite the preventative work that's happening in this field. Now, the data tells us, as you know, that 1 in 2 women and 1 in 5 men over the age of 50 are expected to break a bone in their lifetime. With an aging population, that's a large number of people at risk of injury. The number of people living with chronic health conditions adds further to that risk factor. Despite the frequency of fractures and falls and potential impact on people's lives, bone health doesn't always receive the level of attention of other major health conditions. But it's precisely because of the impact it has on an individual's life and their independence and the impact and costs on the health service, the social services and the wider community that we absolutely need to make it a priority. Now, evidence says that fracture liaison services bring clear benefits to patients in the long term and have been shown to be clinically effective and cost-effective. Last year, I made a commitment to achieving 100% fracture liaison services coverage in Wales by this September. Now, I'm really pleased to say that we've made a huge amount of progress in this area, but as always, there's lots to do. I just checked in with Inder about whether we're on target to meet that September goal, and he assures me that we are. So looking forward to that. It'd be really nice to hit a target in the Welsh NHS at some point. Health boards are at different stages in their fracture liaison service journeys, and coverage, of course, differs from place to place. But we're on a journey towards universal coverage. Much of this progress couldn't have been possible without the excellent clinical leadership that Dr. Singh is providing in this area, working closely with the members of the FLS Quality Assurance Group and the dedicated Health Board clinical leads who offer invaluable advice and support. It's due to the dedication of Dr. Singh and his team that I'm also pleased to confirm that we've secured funding of £1 million from the 6 Goals programme for urgent and emergency care and from the Welsh Value and Health Centre to develop FLS services in areas where there is currently no service and to support the expansion of existing services. Now, as part of this, the Welsh Government is looking to develop a quality statement on bone health. This will set out our vision for the development of better bone health care throughout the life course and across Wales. And I'm sure Dr. Singh and colleagues look forward to support and to using your valuable experience to help develop this document in a truly multi-professional way. We need to enlist your support to help us set the right standards and direction that is needed to integrate health services, also to provide coordinated care for individuals and make a real difference to the quality of care for those who are at risk and those who experience bone health conditions in their lifetime. I thank you all for your continued support in getting us where we are today, and undoubtedly for the support that is yet to come. Without your commitment, there would be no FLS service in Wales. There's an exciting agenda ahead, and you'll be hearing from a range of experts, including the Deputy Chief Medical Officer, Dr. Chris Jones, who is going to offer his reflections on the quality of services and on his vision for the future. Thanks also to Dr. Singh and the conference team for organising this event, and to our speakers and chairs for giving up their valuable time to be here today. Now, today we strive to build our vision for care for older people in Wales. Each and every one of you are important partners in progressing this work and ensuring we have a Fracture Liaison Service which covers everyone in Wales, no matter where they live. I want to finish by stressing that safety and quality of service is everybody's responsibility. I want us to work together to continually improve outcomes and by creating a learning culture and the most comprehensive bone health service in the United Kingdom. Diolch i chi gyd am wrando. Gobeithio allwch chi fanteisio ar y cyfle i rwydweithio a dysgu ac y byddwch chi'n gadael y gynhadledd heddiw gyda gwerthfawrogiad o'r newydd ar ôl gweld yn uniongyrchol sut mae'n gwaith ar y cyd yn gallu creu newid positif. I'd just like to end by thanking you all for listening. I hope you'll take advantage of the opportunities to network today, to learn from each other, and hopefully leave with a renewed appreciation, seeing firsthand how our collective collaboration can deliver positive change and can genuinely transform the lives of people in Wales. Diolch yn fawr i chi gyd. Thank you.
Thank you, Cabinet Secretary. And our shared goal is for the NHS to look at the improved methods of treatment and provide that high quality care, what you heard from the CAPSEC today. And we are very delighted that you are able to join us today and share a very positive news about the funding in particular with us. And we will be working hard to get the quality statement up to that standard, what you expect from us. And we look forward to continue this important work and keeping you informed, our FLS, and when we meet you in person as well.